Hello, hello. Okay, off rip. Did you know that 50% of postpartum complications could be avoided if they are caught early enough? Let me say that again. 50% of postpartum complications, nearly 50%, could be avoided if they were caught early enough. That is why this live is so important. Today, I'm going to be talking about, when to know to call your doctor after giving birth. How to know. When should you call your doctor? So, if you are pregnant, or if you have recently given birth and you are in the early days of your postpartum, then this live is critically important to you, because the information will let you know the red flags that you should be looking out for concerning you and your sweet baby. If this is your very first time joining one of my lives or watching the replay, my name is Stephanie Poole. I am a certified doula and lactation consultant. It is my pure joy to help first time moms transition into motherhood by preparing for their birth and postpartum and breastfeeding journey. So, if that is you, I welcome you to subscribe and turn on notifications so that you don't miss any of my upcoming lives. Every live that I do is like a mini masterclass. And so you don't want to miss one, because if you miss one, you're missing a lot. All right, with that being said, let me just bring up my notes here. And just quickly kind of give you an outline of how this live will be structured. So, I am going to break it down into three different categories. The first one I'm going to talk about will be red flags that you need to be mindful for yourself. Physical red flags that you should be mindful for regarding yourself. The second category that we're going to talk about is emotional and mental wellness for yourself, right? Red flags that you should be noticing concerning that. And then the last part of this live is going to be related to your baby and what kind of red flags you should be looking out for them to know when to contact your provider concerning your baby. So that will be the order of the live. I'm going to talk about those three categories concerning red flags and what you should look out for. Please let me know in the comments if you are pregnant or if you have recently given birth. I just like to know like who I'm talking to and how I can tailor this content to really help you. So let me know in the comments where you are joining from and if you are pregnant or if you've recently given birth and are in the early stages of your postpartum. Also, if you have any questions for me, then leave them in the comments below, because at the end I'll check to see if we have any comments. If so, I will answer any questions you might have, and then I'll be out your way. All right, y'all, let's hop in. I love it when I get a chance to just hop in with you guys. Okay, the first red flag I want you to pay attention to for yourself concerning the physicality of postpartum, right? Physical symptoms that I want you to check for. The first one is going to be heavy bleeding. Heavy bleeding. And let me explain like what's normal and what I mean by heavy bleeding. So, if you've given, let me know, have you given birth? Is this your first pregnancy, or if you've given birth, before? If this is your first pregnancy, I'm going to assume that if you're watching this either live or on the replay, that maybe you haven't given birth before. And so you don't know already that after birth, you will have vaginal bleeding. That is normal. However, when we are concerned, or when it's considered to be a red flag, is when that bleeding that is normal turns heavy. So you might be saying, well, what is heavy? What's normal? What's heavy? So after birth, they will tell you you need to wear either undergarments, like those Depends, right? Those undergarments, or a pad, depending on your flow, because you will be discharging all of you. You haven't had a period for 9 months, right? So that is going to start to your body will cleanse itself. That's normal. However, heavy would be if you're passing clots, or if you have so much bleeding that you have to change your pad within an hour. So if you let's say you get up, you take a shower, you're putting on your clothes for the day, you put on a pad, and then you notice before you can even get dressed and sit down good that you are running through that pad and it's time to change it, that is heavy. That is concerning. That would be your red flag to pick up the phone, call your provider. Hey, I just changed my pad at 9. It's barely 10 o'clock and I'm already like soaking through. That's important. That is important. We need to get that addressed. We need to err on the side of caution. Now, let's say you're stuck. Let's say it's the middle of the night and your doctor isn't open, or they don't have on-call, coverage for you. Maybe it's the weekend, right? I want you to err on the side of caution and check it out. Go to your local urgent care, go get help, than to dismiss it and say, oh, that's not really a big deal. If you are having heavy bleeding and you are running through and soaking those pads and it's barely even an hour, or at max an hour, and you have to change it, I want you to reach out to someone, because I would rather for it to be checked and not be a hemorrhage than for you to continue to lose blood at a rapid rate. That could potentially cause a problem. Remember, at the beginning, I talked about 50%, y'all, can be avoided if they're caught early enough. So that's the goal, to catch it early enough that if there is something going on, we don't just ignore it. We look into it. We pay attention. Okay. So that's the first one. The second one is if you start having any severe pain or swelling, especially in the legs. Pain or swelling, especially in the legs. We like to make sure that there is nothing going on in regards to, like, let's say blood clots, right? We want to make sure that you're not having any kind of blockage or anything with that circulation. And so if you notice, an over amount of swelling. Now, there will be slight swelling, especially maybe if you've had, a C-section. But and when I say swelling, if you put your finger into your skin and it doesn't bounce back, if your skin is so tight, like there's no give to it, those are signs you need to call your doctor. If you are having pain or swelling, especially in your legs, get that checked. That is highly, highly important. Highly important. The other tip that I want to throw in as I'm reviewing my notes here is also to continue to walk. You will notice, especially if you give birth in a hospital, that they like to get you up and moving shortly after birth. And that is even including C-sections, especially C-sections. We don't want you to sit, because you have a lot of blood that's circulating when you are giving birth. So we don't want you to just sit back. We want you to get up and walk ever so often. It doesn't have to be a power walk. It doesn't have to walk with intention or anything like that. But just to have that mobility is key. That is very key, especially in those early postpartum hours and days after having your baby. Okay? All right. So So, as promised, let's move on to the second section I want to talk about, which is the emotional and mental signs that I want you to pay attention to. Now, how many of you know that there's a such thing called baby blues and postpartum depression? Baby blues and postpartum depression. So, baby blues is what we consider to be normal. Postpartum depression is what we like to screen for and have you treated for, because that is the more severe condition that could potentially cause problems if it's severe and left untreated. Okay, so let's talk about baby blues and what's important. I think it's important to just consider what is baby blues and why is it happening. So after you have birth, right? You've had all of these growth hormones and your hormones surging to support you and baby for the last 9 months. Everything has been just, doubling and doubling in terms of the amount of hormones that you have that's showing up in your body to support you and baby. Well, after you give birth, those hormones start to, in the immediate postpartum, they start to plummet and then they kind of level off a little bit. And so when they come down, because they're trying to get back to your pre-pregnancy status, right? You've had the baby, you're at home. And so now your body is doing its best to recover. And in the act of recovering, right, what you'll notice is as those hormones start to go down, and that decline is steep right after you give birth. And then, like I said, as the days and weeks goes on, those hormones really level out. And so when you have that plummet, that is what is triggering that baby blues low form of depression, right? Your hormones, you could be feeling overwhelmed. Your hormones are causing you to laugh 1 minute and to cry the next minute, right? That's normal. That's normal. Here is what I want you to pay attention to when we talk about what's concerning. That is going to happen. It's very normal to happen within those first, what we like to say, 2.5, maybe 3 weeks at best. After that, it's not that you are totally back to normal, but it's less of a steep decline. And so things are starting to, level out a little bit and slowly get back to your pre-pregnancy state, right? After those first few weeks, after you give birth. Now, this is what I want you to pay attention to. With all that being said, after 2 to 3 weeks, if you are still having pervasive, consistent thoughts of feeling, down and isolated, hopeless, not connecting with your baby, feeling like you don't really have a worth or a purpose. If you are having those thoughts and they are persistent, not letting up, as a matter of fact, usually they even intensify over time, right? If that is something that you are noticing in yourself, or let me even go so far as to say, if you happen to be watching this video and maybe it's not you that's pregnant, but a loved one or a partner, then pay attention to that. Because if it is something that is lingering, right, then that is our sign to know, okay, it's now been 3 weeks, 4 weeks, and this isn't getting any better. It's not tapering off. In fact, it's persistent or getting worse. That is the difference. I hope that helps. All right. So now that we've talked about that, the very last thing that I want to cover is what we talked about at the beginning, which is the concern that you may have related to your baby in terms of if you should call your provider. And so what I mean by that is, um, we always want to make sure that baby is, able to breathe, that there's no choking or anything like that going on. Those are obvious red flags, no worries. We know those to be, you know, worth reaching out to do, right? They require immediate evaluation and correction for the life of your baby. So those we're handling that. The one symptom that I want to really focus on is a fever. Your newborn baby should not have a fever. Newborn babies should not have a fever. Okay? They are new. Their system is starting to really fire up to support them now that they are not attached to you via the umbilical cord. So now everything has kicked on and started to support your baby. They should not have a fever. They should not have a fever. If your baby has a fever, which would be anything over, I like to say 100.4, your doctor may have a different threshold. So definitely, check in with your provider to see what their threshold is, especially for a newborn. I like to be very sensitive in that area. So I say 100.4, which is pretty much across the board. You'll find that in a lot of documentation. Check with your provider to make sure that that is what their standard or threshold is. But if your baby has a temperature, you definitely want to reach out. If it's at night, if it's on the weekend, I want you to err on the side of caution and check it out than to not do it. Okay? Especially for a newborn. Newborns are very vulnerable because they are so new and their body is still trying to regulate itself. It's been dependent on you for 9 months. And so in the postpartum, in those early hours, days, and even weeks after giving birth, your baby is really working to regulate themselves. And so in doing that, let me just say, put this on your registry if you have not given birth. And if you've already given birth, make sure you head to the local pharmacy and keep a thermometer on hand, because it will be a lifesaver. You personally may feel the baby's head and say, oh, they feel warm. But do you have a thermometer that you can actually take a reading? Why? Because that will help you to know for sure. And if you do have to reach out to a healthcare provider, you'll be able to give them the exact temp. I took it, 30 minutes ago, it was this. I took the temperature again 10 minutes after that, and here is what it registered. So having that thermometer is going to really play a key role in terms of you being able to communicate with your provider if you notice that there is a fever and you do need to reach out. But newborn babies should not have fevers, not healthy newborn babies, right? We should have that looked at and checked out by your provider. So just as a quick recap, and I have my little notes here of to the point things I want you to make sure you pay attention to. If you have heavy bleeding, right? If you are having severe pain or swelling, especially in the legs, I want you guys, right after you are done giving birth, within those first few hours, you should be up and walking. And in a lot of hospitals, those nurses will come around to get you out of bed, to make sure you're getting up and kind of moving to avoid any blockages or any kind of complications in regards to that. So heavy bleeding, severe pain, swelling, any fever, and you want to pay attention to your mood and mental status in those early days to make sure that they are not persistent and intrusive, and to make sure that they are not lingering symptoms that are getting worse, especially after that 2 to 3 weeks. they should definitely be, mellowing out at that point. And so if they are not, I want you to reach out for help. Now, in this instance, I can always hear someone saying, "Well, I don't want to really give them a call if it's not, if it's not anything. I don't want to bother somebody. I don't want to make it a big deal if it's nothing." Well, especially if you're a first time mom, you don't know. You have to be able to have the comfort of knowing it's okay. And so I'm saying it to you right now on this live. It is okay to reach out to your provider if you have questions or concerns regarding your health or the health of your baby. It's important. It's important that you feel comfortable enough. It is not a bother. When we work in this industry of healthcare and being, a provider, they are on call for a reason. This is their profession. This is what they do. So it's not a bother for you to reach out and say, "Hey, I'm a bit concerned," either because of symptoms that you're noticing in yourself or symptoms that you're noticing with your baby. And so if I could have you take away anything that I said today, is to always, always err on the side of caution, because it's better to have something checked out and have it not be anything of concern, as opposed to being plagued with something that could have been avoided. And I'm going to go back to my statistic I used in the very beginning, which is 50% of postpartum complications could be avoided if they are caught early enough. 50%. That's a big number. That's nearly half. Nearly 50%. So that's right at half can be avoided. We don't want to have you in an extreme situation when that situation could have been avoided with a simple call or a simple drive over to the urgent care or whatnot, right? So I am saving space for you here to say, if you have a question, ask it. If you have a question, ask it. Your health is that important. Your baby's health is that important. And so don't ever feel like, I don't want to bother someone or I don't want to make it a big deal. No, reach out to your provider so that we can answer the questions and help you really, navigate your health and your health conditions and concerns. All right. Thank you so much for joining me today. If you enjoyed this live, please share it with another pregnant mom who could potentially get value from this. Like the video, it always encourages the channel. And I welcome you to subscribe and be a part of the Birth Prep Academy family. I go live often. And like I said, every live is, in fact, a masterclass. I treat it that way. I try to hit all of the important things that I know I get in my DMs and, under my videos, different questions. And so thank you for being here with me today. If you would like to work with me one-on-one, I do have a link listed in the description box below. I can help you prepare for your birth or to prepare your breastfeeding journey. And I absolutely love it. It is my absolute joy. And I want you to get off to a good start. I want you to have a positive birth experience and a positive breastfeeding experience. And so I'm here to help you do that. The link is below, as well as my course, Bump to Bundle Blueprint, that can help you to prepare from beginning to end. As a doula, it is my exact strategy that I have extracted to offer to you. It is the exact blueprint that I use with my clients. And so if you're interested in that, please check out the description box below. Until the next time that we can get together, video, live, whatever it is, thank you so much for joining. Until next time, guys, happy birthing.